Hello, everyone. Today we will study the common disease in cardiovascular system. It is hypertension. So we will study antihypertensive drugs. And in this class, we should know something about hypertension. So from this table, for example, in your age 20 to 24 years old, and for our normal subjects, systolic blood pressure about 120, 100 to 130, and diastolic blood pressure nearly 76 to 84, 83. And for another example, 70 years old, systolic blood pressure 145, diastolic blood pressure 82. So from this table, I only want to tell you our blood pressure will increase follow with our age, the first aim. The second aim, from this table you should know, later we treat hypertension. We use antihypertensive drugs, and for elderly patients, we don't need to reduce the blood pressure to 120 mmHg for them. And in fact, 150 or 140 mmHg is normal in their age. Okay. How to diagnose hypertension? So we divide hypertension into three states. The first stage, mild patients. Mild patients, the patient's systolic blood pressure from 140 to 159 mmHg, and their systolic blood pressure from 90 to 99 mmHg. During this period, for mild patients in the first stage hypertension, some of them, they don't know they are hypertension patients. Why? Because some of them, they don't have any symptoms. Because they don't have any organ damage. And then, the second stage hypertension, moderate hypertension patients, their systolic blood pressure from 160 to 179 mmHg, and their systolic blood pressure from 100 to 109 mmHg. Yes, for the moderate hypertension patients in the second stage, most of them, they have obviously symptoms such as headache, such as dizziness, such as nasal bleeding, because they have organ damage. Though they have organ damage, some of them, they still not think very important, very serious. Why? Because their organ is normal. Organ function are normal. And the third stage, they are serious hypertension. Serious hypertension means patients' systolic blood pressure more than 180 mmHg, and their systolic blood pressure more than 110 mmHg. During this period, there are serious hypertension. In the third stage, they have organ damage and their function are dysfunction. So we divide hypertension into three stages. They are mild, moderate, and serious hypertension. And how to diagnose hypertension? We only test diagnosis hypertension only in accord with their blood pressure, and the blood pressure higher than normal in different 2 days, we can diagnose the patients is hypertension patients. And from this table, just now I use two words. Do you remember? Between them, I use and or. and means both of them, systolic blood pressure and diastolic blood pressure increase. The patients, they are hypertension. All means one of them higher than normal, they are still hypertension patients. Okay. How to diagnose hypertension? Just a note from the table we have known. Essential hypertension may be divided into three classes, three stages, according to the severity of the conditions. Mild patients in the first stage is characterized by sustained documented systolic pressure of 140 to 159 mmHg or diastolic blood pressure from 90 to 99 mmHg. The second stage hypertension, moderate hypertension, is characterized by sustained documented systolic blood pressure of 160 to 179 mmHg or diastolic blood pressure from 100 to 109 mmHg. And the third stage, serious hypertension, and their function abnormal. They have target and organ damage. The serious hypertension is characterized by a persistent elevation, systolic blood pressure more than 180, diastolic blood pressure more than 110. And we should diagnose the patients and test the blood pressure in different 2 days. Higher than this value, we can diagnose the patient is a hypertension patient. Okay, we also divide hypertension into two kinds. Just now, we divide hypertension into three stages. And here, you should know, we also divide hypertension into two broadly categories. The first kind, most hypertension patients, more than 90% hypertension patients, they are essential hypertension. They are primary hypertension. Why they are hypertension patients? We still unknown. We still unclear. And maybe for these reasons, so we know the high risk factors. For example, family history. More than 40% hypertension patients, they have family history. So that means if your parents, they are hypertension patients, when you are in 40 to 50 years old, you will be a hypertension patient, and the incidence higher than the others. Family history is the high risk factor for hypertension. And the second one is obesity. Yes, obesity is a high risk factor not only for hypertension but also for hyperlipidemia and hyperglycemia. And the next one, mental stress. I think each of you have the experience. If later you will have an examination, and you are anxiety, and you test your blood pressure, you will find your blood pressure higher than normal. Why? Because mental stress can increase blood pressure. For the other example, in clinic, especially some elderly patients, they will tell you, doctors, in my home my blood pressure is normal, but when I saw your white coat, I'm nervous. My blood pressure higher than normal. We call this pseudomonas hypertension, or we also call this white coat hypertension. Why? Because mental stress, because this can affect blood pressure, can increase blood pressure. And other high-risk factors such as drinking and smoking. So for this reason, we should tell our hypertension patients they should discontinue with use drinks and smoking. The last high-risk factor is sodium salts. Intake more sodium salts also increase blood pressure. So later we treat hypertension, we should limit sodium salt intaking. Do you know in average each day you will intake how many sodium salts? 10? Yes, 10 gram. Each day we intake 10 gram sodium salt. And just now we have mentioned sodium salt is the high risk factor for hypertension. So later we treat hypertension, we should improve the patient's life behavior. We also should limit sodium salt intaking less than 6 grams each day. The first kind, essential hypertension. And some patients, we know the reason why they are hypertension, why their blood pressure increase, because they have other disease. So we call them, they are secondary hypertension. About 10% hypertension patients, they are secondary hypertension. Because we know the reason, because they have this disease. For examples, renal disease patients, because they have renal disease, maybe renal function decreased, maybe for their renal blood flow reduced. So then their blood pressure will be increased. They are secondary hypertension. And the next example is a pheochromocytoma. Do you remember you have studied this disease? And do you remember which drug is the first choice agent to treat, to diagnose pheochromocytoma? Do you remember you have studied this? Yes, we should use alpha receptor blockers to treat, to diagnose pheochromocytoma, such as phentolamine. And pheochromocytoma is one kind of tumor on adrenal gland. And this tumor, pheochromocytoma on adrenal gland, can release more adrenaline, noradrenaline. And these patients, their blood pressure very high, maybe more than 200, more than 220, 40 millimercury. And these patients, very dangerous. And these patients, in clinic, if you have these patients, you should give phentolamine to reduce the blood pressure. And if you give phentolamine to these patients, their blood pressure reduced in 5 minutes. Oh, you can diagnose the patients is pheochromocytoma patients. And then you can use CT scan to diagnose the patients. And then we should do the surgery to cut the tumor for these patients. But you should know, we do the surgery for these patients, we must control the blood pressure. So we still use phentolamine to reduce, to control the blood pressure for pheochromocytoma patients. And the next example is pregnancy. Pregnancy, yes, the great mother, especially for the late pregnant, and their blood pressure increase. And we should use antihypertensive drugs to treat pregnancy with hypertension. But now my question is, doctors, in your mind, which kind of drugs we can use to treat pregnancy with hypertension? CCB, ACEI, or ARB, or diuretics, or beta receptor blockers? Yes, you are right. We should use CCB, calcium channel blockers, to treat pregnancy with hypertension, secondary hypertension. Okay. And the general symptoms of hypertension. 20% hypertension patients, they don't have any symptoms, especially mild patients. And some mild patients, they feel headache, dizziness, palpitation, or weak fatigue. For serious hypertension patients, they have some complications, such as blurred vision, such as nasal hemorrhage, or gingival hemorrhage, such as multiple organ damage. The worst sequelae of hypertension is the cerebral hemorrhage. Signs of hypertension, such as blood pressure increase, especially obviously increase in the morning 9 to 10 o'clock. Accentuation of second heart sound. So next semester, you will study diagnosis. You will know this. And hollow systolic murmur in aortic first osculation error. These are classical symptoms and signs of hypertension. Before we study antihypertensive drugs, and let's review about blood pressure. In your physiological class, you have studied arterial blood pressure determined by two factors. One is cardiac output. The other factor is peripheral vascular resistance. And cardiac output also determined by heart rates, by myocardial contractility, and by retained blood volume. So we have known heart rate increase, or myocardial contractility increase, or retained blood volume increase, will increase cardiac output, will increase blood pressure, induce hypertension. So from these factors, that also means if we can use some drugs to reduce heart rate, or use drugs to reduce contractility, or use drugs to reduce retained blood volume, that means this drug can reduce cardiac output. This drug can reduce blood pressure. That means we can use this drug to treat hypertension. So now my question is, doctors, do you remember we have studied some drugs can reduce heart rate and reduce myocardial contractility? This drug have negative inotropic action, negative chronotropic action. Do you remember which kind of drugs can reduce heart rate and contractility? Do you remember? Yes, you are right. We studied beta receptor blockers have negative inotropic action and negative chronotropic action, can reduce heart rate, can reduce contractility. Yes, later we will use beta receptor blockers to treat hypertension. Do you remember we studied the first drug, CCB, calcium channel blockers? Block calcium channel also inhibit heart rate, also reduce myocardial contractility. So that means, yes, we also use calcium channel blockers to treat hypertension. And the next one, do you remember we have studied which kind of drugs can reduce retained blood volume? Which kind of drugs can reduce retained blood volume? Yes, they are diuretics. Diuretics increase urine, reduce retained blood volume, so reduce preload, reduce blood pressure. We also use diuretics to treat hypertension. And the second factor is peripheral vascular resistance. Peripheral vascular resistance determined by length and radius of the vessel and also determined by viscosity. So that means if some drugs can dilate vessel, means reduce peripheral vascular resistance, reduce blood pressure. So now my question is, which kinds of drugs can reduce peripheral vascular resistance? They are vasodilators, such as alpha receptor blockers, such as CCB, such as directly vasodilators. So that means later we will use these drugs to treat hypertension. Except these factors, and in physiological class, we also studied blood pressure also be regulated by pressure receptor, such as carotid sinus, aortic arch, also be regulated by chemoreceptor, such as carotid body or arch body. Except this, blood pressure also be regulated by sympathetic nervous system, and we also found in hypertension patients their sympathetic nervous system overactivity. Sympathetic nervous system overactivity, vasoconstriction, and induce hypertension. So if we can use some drugs inhibit sympathetic nervous system, means can reduce blood pressure, can use to treat hypertension. So do you remember which kind of drugs can inhibit the sympathetic nervous system? You have studied alpha and beta receptors antagonists, phentolamine and propranolols. So we can use them to treat hypertension. And except sympathetic nervous system, we also found, especially long-term, in hypertension patients, their renin-angiotensin system overactivity, induce blood pressure increase, induce hypertrophy and remodeling. So, means we can use inhibitors, inhibit renin-angiotensin aldosterone system, can inhibit this system, can reduce blood pressure. So do you remember we have studied two inhibitors can inhibit renin-angiotensin system. They are ACEI and ARB. Excellent. Yes, ACEI and ARB. We can use these two inhibitors to inhibit renin-angiotensin system to treat hypertension. Cardiovascular system can regulate blood pressure by itself by negative feedback. So for this reason, in clinic, we use these drugs to treat hypertension. So the classifications of antihypertensive drugs. The first kind, the oldest drug used to treat hypertension, they are diuretics. In diuretics, we should know the moderate efficacy diuretics, Cerazide, is the first line antihypertensive drug. The second case inhibit sympathetic nervous system. So, at first, on the highest level, in the central level, inhibit sympathetic nervous system, and the central acting antihypertensive drugs. Later, we will study the drug is clonidine. And the second level, in neuroganglion level, inhibit sympathetic nervous system. Two drugs, reserpine and guanidine. Later, we will study these two drugs. And the third one, on the receptor level, inhibit sympathetic nervous system. There are two inhibitors, alpha receptor blockers, such as prazosin, beta receptor blockers, such as the prototypical agent is propranolol. The second kind, antihypertensive drugs. These drugs are alter sympathetic nervous system. The third kind of antihypertensive drugs, they are vasodilators, such as nitroprusside sodium, such as nitroglycerin. The third kind, antihypertensive drugs, they are diuretics, vasodilators. And then number 4, the fourth section, the fourth kind of antihypertensive drugs, they are CCB, calcium channel blockers. We have studied calcium channel blocker divided into three kinds in accord with their age. First, second, and third generation CCB, nifedipine, nimodipine, and amlodipine. In this class, we will study how to use them to treat hypertension. The last part, in antihypertensive drugs, these drugs inhibit renin-angiotensin system. Two inhibitors, ACEI, the prototypical agent is captopril, and ARB, angiotensin II, the first receptor blockers, such as the prototypical agent is losartan. So, next class, we will study these 5 kinds of drugs to treat hypertension. And in these 5 kinds of drugs, in clinic, in them, 4 kinds of drugs as the first line antihypertensive drugs. They are, the first one is thiazide. The second one, beta receptor blockers. The third one, CCB, calcium channel blockers. Number 4 are ACEI. So these 4 kinds of drugs, they are the first line antihypertensive drugs. Next class, we'll study the details. Okay, this class is over.